Bismillah ar-Rahman ar-Rahim. Today I will explain 10 different signs which can help to elicit the acute appendicitis in a patient who has presented with the abdominal pain. As you know that any patient who presents with the RIF or right iliac fossa pain should be considered as an emergency and should be considered as a patient of acute appendicitis until and unless proven otherwise. And this is true for all patients. Even if a patient has Crohn's disease or he has an established UTI, even then, considering the severity of the pain, acute appendicitis should not be ruled out and should be kept in mind, because the two entities can exist concurrently. Anyhow, the patient of right iliac fossa pain has come, and the first test is McBurney's test. There is palpation at the McBurney's point, which is now called petit triangle, will cause pain. So, what is McBurney's point? If you draw a line from umbilicus to the superior iliac crest, then McBurney's point is situated one third of this distance from the superior iliac crest. Next is the Bloomberg sign, which is rebound tenderness. That if you palpate the REF area or the McBurney's point and press it and then suddenly release the tension, there is pain, and this is called rebound tenderness, which is Bloomberg sign. The third sign is rousing sign, which is also called Perman sign, that the pain occurs in the right iliac fossa when when the doctor palpates or presses at the left iliac fossa, and this is because there is an increase in pressure on appendix by pushing bowel contents towards the ileocecal valve. Next is shows sign that there is right iliac fossa pain when passive extension of the right hip or active flexion of the right hip is done when the person is supine, and this pain is due to the inflammation of peritoneum above the appendicular area. Then next is the Dunphy's sign that asks the patient to cough. If pain increases at right iliac fossa, then the Dunphy's sign is positive. Next is obturator sign, and the hip is flexed and then ankle is rotated laterally, there is pain in the right iliac fossa. Next is the kosher sign, that if the pain starts first at the umbilical region and then goes to the right iliac fossa, this is called kosher's sign. Then is the Mesu sign, which is very interesting sign, that the examiner with the help of index and middle fingers sweeps from the xiphoid process to first in the left iliac fossa and then to the right iliac fossa. The patient will have pain and will grimace on the right side. Next is the Sitkovsky sign that asks the patient to lie on his left side, and there will be increase in pain in the right iliac fossa when the patient lies on his left side, and this is called Sitkovsky's sign. The last but not the least is hamburger sign, and as the name indicates that there is something in relation with the food. Yes, the patient will refuse to eat or take food, and this is 80% sensitive for acute appendicitis. Thank you very much for listening, and for Alvarado score, please see another video on the same BEEBANI channel. Thank you very much, and God bless all of you. Assalamu alaikum.